Biomed, Nexus Daily Updates, your essential biotech, medtech, and pharma recap. No noise, just what matters. TLDR Pfizer, PFE, and China's Innovent Biologics agreed to a global licensing and collaboration deal worth up to 10.5 billion to develop 12 early-stage cancer medicines, according to Lambda Biologics and multiple outlets. This is the largest single China licensing transaction of 2026 by total potential value. Eli Lilly, LLY, signed a partnership worth more than 3 billion with China's Haisco pharmaceutical group spanning 5 programs, according to Biospace. This is Lilly's 11th deal of 2026. Lilly and Haisco have yet to disclose specific indications. Combined with BMS Hengrui, 15.2 billion, 13 programs, May 12th. 3 mega China licensing deals totaling more than 28 billion in potential value were announced within a single month. The Coins Act push to restrict outbound capital to Chinese biotech faces a growing disconnect with the pace of actual deal flow. GSK shared early ASCO data suggesting its KIT inhibitor from IDRx acquisition could overtake Novartis's Gleevec as the standard of care for gastrointestinal stromal tumors, according to Fierce Biotech. Executive take away the China licensing wave we have tracked since the BMS Hengrui deal on May 12th just accelerated dramatically. In a single day, Pfizer signed a 10.5 billion deal with Innovent for 12 oncology programs, and Lilly signed a 3 billion plus deal with Haisco for 5 programs. Add BMS Hengrui, 15.2 billion, 13 programs, Merck Kellen Biotech, SAC TMT, multiple phase 3 wins, GSK Seron Bio, 1 billion, ALK7, AbbVie, Haisco, NAV 1.8, and Lilly Hengrui via Calera. And the West to China licensing pipeline now exceeds $50 billion in announced potential value in 2026 alone. The strategic rationale is unchanged. Chinese biotechs produce high-quality clinical stage assets at lower development costs. Western pharma gets pipeline optionality. Chinese companies get upfront cash and downstream economics. But the geopolitical tension is intensifying. The Coins Act push to restrict outbound capital to Chinese biotech is gaining congressional momentum at the exact moment the deal flow is hitting record levels. Meanwhile, GSK's KT inhibitor data from ASCO suggest the company may have another franchise-level asset from its IDRx acquisition. And Lilly's deal count has reached 11 in under 6 months, a pace that may be without precedent in pharma history. Read Full Analysis What to Watch, Jefferies Global Healthcare Conference, tomorrow, June 4th. New York. Strategic Management Presentations post ASCO, China Licensing Strategy Commentary from Pfizer, Lilly, and BMS expected. Coins Act Legislative Progress, Congressional Push to add biotech to outbound capital restrictions. The 50 billion plus in 2026 China licensing deals creates both the rationale, dependency concern, and the counter-argument clinical value for the legislation. Revolution Medicines CNPV filing, still expected imminently following the ASCO plenary and NEJM publication. Every day without a filing announcement is noted. Pfizer Innovent Program. Details 12 oncology programs is a broad bet. Watch for disclosure of specific targets, modalities, and development stages. Medicare GLP-1 Bridge, July verse. 4 weeks out. Top story Pfizer and Innovent sign. 10.5 billion oncology. Licensing deal. PFE Pfizer and China's Innovent Biologics agreed to a global licensing and collaboration deal worth up to 10.5 billion to co-develop 12 early-stage cancer medicines, according to Lambda Biologics and multiple outlets. The deal includes an undisclosed upfront payment plus development and commercial milestones. Pfizer gains rights to develop and commercialize the programs outside Greater China. Innovent retains Greater China rights. Specific targets and indications have not yet been disclosed. This is the largest single China licensing deal of 2026 by total potential value, surpassing BMS Hengrui, 15.2 billion, but across 13 programs versus Pfizer Innovent's 12. Lilly adds 3B plus Haisco partnership as its 11th deal of 2026. LLY Ely. Lilly signed a partnership worth more than 3B with China's Haisco Pharmaceutical Group, spanning 5 programs according to Biospace. This expands on the earlier AbbVie-Haisco NAV 1.8 pain deal and signals that Haisco has become one of the most active Chinese licensors alongside Hengrui and Kelun-Biotech. Lilly and Haisco have yet to disclose specific indications. This is Lilly's 11th deal of 2026, bringing total announced deal value above 28B. China Licensing Scorecard, 2026 Deal Potential Value Programs, Date BMS, Hengrui 15.2B13, Oncology, Hematology, Immunology. May 12th Pfizer, Innovent 10.5B12, Oncology. June 2 Lilly, Haisco 3B plus 5, undisclosed. June 2 GSK, Cyran Bio 1B1, ALK7, siRNA, cardiometabolic. May 6 ABVI, Haisco undisclosed 2, NAV 1.8 pain. April 29 Merck, Kelun-Biotech undisclosed multiple, SAC-TMT ADC lead, ongoing, Lilly Hengrui via Kylera. IPO 625 May 4, GLP-1 obesity, ongoing total announced potential value more than 30B across 37 plus programs, total including undisclosed terms likely exceeds $50. Clinical and research updates GSK KIT inhibitor could overtake Gleevec in Gistfius Biotech, reported that GSK shared early ASCO data suggesting its KIT inhibitor, acquired through the IDRx deal, could overtake Novartis's Gleevec, imatinib, as the standard of care for gastrointestinal stromal tumors, GIST. Gleevec has been the GIST backbone for more than 2 decades. A next-generation, selective KIT inhibitor with improved efficacy and tolerability could capture significant share in a market Gleevec has dominated for more than 2 decades. Detailed data will inform whether GSK pursues a pivotal trial. Ivonescimab. Detailed data draw. Scrutiny Fierce Pharma reported that while Ivonescimab's 34% improvement in overall survival exceeded expectations, detailed data from the Harmony-6 trial are being picked apart by analysts and oncologists. Key questions center on the comparator tislelizumab, not Keytruda, the Chinese-only enrollment, and whether the benefit translates to Western patient populations. Summit Therapeutics, US partner, will need to address these concerns as it plans its US regulatory strategy. The week ahead tomorrow, June 4th, Jefferies Global Healthcare Conference, New York, June 2026, ADA 2026, GLP-1 obesity data, June 2026, Takeda CEO transition, Julie Kim, imminent revolution. Medicines CNPV NDA filing, July 1st, Medicare, GLP-1 Bridge Program launches, June 22nd to 25, Bio International Convention San Diego, Read, Full Analysis, Biomed, Nexus Pro Institutional Intelligence Brief, the China Licensing Paradox. On one hand, Congress is pushing to add biotechnology to the COINS Act, which would restrict U.S. capital flows to Chinese biotech. China's Decree No. 834 gives Beijing new powers to investigate foreign companies. The geopolitical tension is real and intensifying. On the other hand, BMS signed 15.2B with Hengrui, Pfizer signed 10.5B with Innovent, Lilly signed 3B plus with Haisco, GSK signed 1B with Cyran Bio, AbbVie signed with Haisco. Merck's Kelun-Biotech partnership just produced 2 Phase 3 wins, all in a single month. The disconnect is stark. The political rhetoric says decouple, the deal flow says accelerate. Both things are happening simultaneously. The resolution will come in one of 3 ways. COINS Act passes and deals freeze. New deals stop. Existing deals continue under existing contracts. The pipeline of Chinese-originated assets entering Western development slows dramatically. COINS Act fails and deals continue. The current pace holds or accelerates. China becomes the dominant source of early-stage clinical assets for Western pharma. A middle path emerges. Restrictions apply to certain sectors, AI, semiconductors, defense-adjacent biotech, but exempt pharmaceutical licensing. This is the most likely outcome but the most uncertain. For BD teams, assume the current deal window remains open but may not last indefinitely. If you are evaluating Chinese assets, the window to close deals may be narrowing. Lilly, 11 deals, 28B+, 6 months. Updated running. Total deal value area Warner Therapeutics, 2.4 bi in vivo CAR-T, autoimmune, 2 Centessa. Pharmaceuticals, 7. 8B in narcolepsy, 3 Colonia. Therapeutics, up to 7 bi vivo. CAR-T, myeloma, 4 Crossbridge. Bio up to 300 men dual payload, ADC 5 Ajax. Therapeutics, up to 2.3B type 2, JAK2, myelofibrosis, 6 Profluent. Bio up to 225 BAI gene editing, collaboration. Engage Biologics, undisclosed, non-viral DNA delivery, Curivo up to 1.5B shingles vaccine, 9 Limitech. Biologics up to 718 bacterial vaccines, AMR, 10 vaccine company, up to 1.55 BEBV nanoparticle vaccine, 11 Haisco. Partnership 3B+5 programs undisclosed. Total, approximately 28.9B+ across 11 deals in under 6 months. Catalyst, calendar, June 2026. Forward date, event tickers, tomorrow June, for Jefferies Global Healthcare Conference, New York. Multiple, June 2026 ADA, 2026, GLP-1 obesity data, LY NVO, KLRA June 2026 Takeda CEO transition, Julie Kim, TAC June 22-25 BIO International Convention San Diego, multiple imminent revolution medicines, CNPV NDA filing RVMD late, Q2 Lilly Foundio T2D filing under CNPV LLY Q3, 2026 revolution, medicines Daraxon Racib approval projected, Truist RVMD July, 1 Medicare GLP-1 bridge program launches, LOI NVO Q3, 2026 Teva, Emalex, close expected Teva July. 31 Section 232 Pharma tariffs, effective, large companies. Multiple August 20 Capricorn, Diramucel, PDUFA, Duchenne Cell Therapy, CPRH2, 2026 Merck, SACTMT Global Filing, expected MRKH2 2026 Foundeo, T2D Regulatory Action, expected LLY 2026 Triumph H2, Retatrutide T2D, readout, expected LLY DEC 2026 Minerales, Lorundrostat, PDUFAM Ly S2027 Retatrutide launch, anticipated, BMO, LY DEC 7 Lilly, investment community meeting, visit the Pro Hub read. Full article, is your company listed in the Biomed Nexus directory? 104 companies across 14 categories. Claim or upgrade your listing. Sponsorship slots for 2026 are limited. See packages and pricing. New Biomed Nexus signals weekly sales intelligence for life sciences BD teams. Learn more.